Thank you so much for tuning in. Today we're going to be discussing cluster B personality disorders. If you want a free study guide, make sure you email nursingwithprofessorb@gmail.com. Cluster B personality disorders. These are characterized as the dramatic, the emotional, and the erratic. So cluster B, if they're antisocial, they have that deviant behavior, maybe they'll end up in jail. If they're emotional, with the borderline, one minute they love you, the next minute they hate you, we call that splitting. The histrionic, that's the dramatic, and this person's on the runway and they're attention seeking and it's all about me. And then the narcissist, they think that they are the best. I am the absolute best, the best at everything. Everybody loves me. I'm so smart, intelligent, and they are above everybody. So he has a PhD, and this was blurted out, and I actually use this in my class, so I had to blurt out, but this said a PhD of BS, but it actually said the B word. And of course, you are beneath me. Histrionic personality disorder, they don't frequently test you on this on nursing exams, but it's important to know. The mnemonic I crave sin, they have inappropriate behavior. They're seductive or provocative. Notice how here she's with a guy, we'll say that that's Hugh Hefner, and she's like a playboy girl. They want to be the center of attention. Relationships are seen closer than they really are. So for example, histrionic would be, I met someone yesterday and I'm saying that I'm going to marry them, that he's the one and he's it. They want to be the center of attention. Relationships are seen closer than they really are. Appearance is most important. So for example, they may have boob jobs, butt jobs, Botox, anything. Think of a peacock. And with, not that this is important to know, but peacocks, the ones with the feathers like that, are the males. But this would be the female version of the peacock, like, look at me, look at me. They're vulnerable to the suggestion of others. Their emotional expression is exaggerated, so they'll be like, oh my darling, I love you. Shifting emotions are shallow. Their language is impressionistic, so everything is amazing and wonderful, but they're not really saying anything. They don't, if you ask them to describe what's so amazing about it, they're like, it's just phenomenal. They just add these empty adjectives. Novelty is craved. So once again, display of shallow emotions. My dog just died. Oh, how sad. Anyway, about the party tomorrow. The use of physical appearance to draw attention to themselves. So they'll have a nose job, boob job, highlights, Gucci sunglasses, Hermes bag, Jimmy Choo shoes. Like, they are on point. Their hair is blow dried, straight. It looks beautiful. Yeah. Exaggerate expression of emotion. Darling, how I've missed you. And the guy says, you know her well? And he's like, no, I've only met her once. I don't know who she is really. And then they're easily influenced by others. They see a commercial of ShamWow or buy these latest shoes, and but wait, there's more. And she's like, I must order this now. So for example, I'm not saying everyone that buys this is histrionic, but Kylie Jenner comes out with a new lip kit, and the girl, the histrionic person's like, I must have this. That whole family, they come out with whatever, and the person will be buying everything that they order, everything that they produce. Now, with histrionic, you see the bright colors. They love excitement, being the center of attention. They're going to be wearing high heels. And Miley Cyrus has kind of cleaned up her act a little bit. But imagine a histrionic. This would be an example of histrionic. Imagine going to a job interview dressed like that. Now, celebrities can get away with a lot, and I'm not saying that Miley Cyrus is histrionic. All I'm saying is that in this case, she is dressed histrionically, if we will say that. I mean, look at these glasses, the little pasties on the breasts, bright colors. It doesn't get more histrionic than that. With histrionic personality disorder, they are excitable, dramatic, yet they are high functioning. It's the drama queen. Extroversion, flamboyant, colorful personalities, limited ability to develop meaningful relationships. They are egocentric. They can be impulsive and they may act flirtatiously or provocatively. They can be very, again, seductive. Their relationships do not last because the partner often feels smothered or reacts to the insensitivity of the histrionic person. Because it's all about the histrionic person, the other person feels like, wow, this is a really one-sided relationship. And there's no insight into their personal role in breaking up the relationship. So they just feel like it's all about, it's all the other person's fault. Guidelines for nursing care: understand that seductive behavior is a response to distress. If for a nursing tip that I can give you for an exam, what to associate histrionic with: hypersexual, right? If you're on an exam and you're like, is this narcissistic or is this histrionic? And the histrionic exam question is like, this girl like lifted up her blouse and was like, hey baby, that's histrionic. Okay, a narcissist wouldn't necessarily do that. So keep communication and interactions professional. Encourage concrete and descriptive rather than vague and impressionistic language. So instead of saying, for example, the histrionic person says, oh, that group was just phenomenal. Well, what was phenomenal about it? Well, I really liked the discussion that we had and it gave me insight. So there you're digging a little deeper and you're forcing them to think a little bit more about, instead of just calling things amazeballs, they have to be a little bit more specific. Assist the patient to clarify feelings. You want to teach and role model assertiveness. Assess for suicidal ideation, and because they are dramatic, suicidal gesture may actually result in suicide. So they may not attempt, they may actually just be gesturing that they're going to commit suicide, but they may actually cut a little too deep or take one too many pills. Treatment. Psychotherapy may promote clarification of inner feelings and appropriate expression. There's no specific pharmacological treatment for this. If they are depressed, they can take antidepressants. If they're anxious, they may take anti-anxiety agents and antipsychotics for derealization or illusions. Now let's talk about the narcissist. And we see Gaston here. He is looking in the mirror. He is the most beautiful, gorgeous, handsome thing that his eyes have ever seen. That is the narcissist. So the narcissist, they say things like, that's enough of me talking about myself. Let's hear you talk about me. Or, it's not easy being superior to everyone I know. Narcissistic personality disorder. They have a grandiose sense of self-importance. I am ridiculously good looking and my famous comics are a form of art. They require excessive admiration. What's up, Julie? Excuse me, where's the red carpet and fanfare to greet me? They believe that they are special with unique traits and high status. Whatever, these stupid, ugly, non-artistic people will never understand how truly great my comics and I are. So let's say the narcissist gets dumped. Oh, it will be nothing. And let's say the narcissist was caught DMing a bunch of girls. This is the narcissist explanation for being dumped. Oh, whatever, she's just an insecure little, you know what. I can DM whoever I want. It doesn't mean anything. I mean, it wasn't even that serious. She's so dumb. They have a sense of entitlement. I have to wait in line. This is, and again, this author wrote BS here, but wrote out the word, so I had to blurt it out. Narcissistic personality disorder. Oh my. They can be so charming. And you don't find out till later that they are freaking narcissists. They have a sense of entitlement, exaggerated belief in one's own importance. They lack empathy. So, with the narcissist, they are dating a narcissist. Let me just tell you, this is a disaster. Do not do it. Because everything is about them. And no matter what happens, it's all the other person's fault. It's not their fault. So, you leave a narcissist, you think you're ever going to find anyone to love you like I did? Or a narcissist cheats on you, their explanation would be like, well, it's all your fault. You shouldn't have gained those 20 pounds. I've been telling you to get to the gym. That is a narcissist. Lack of empathy, lack of saying, I'm so sorry. What I did was wrong. I'm sorry that I hurt your feelings. I can't believe I did that. It was a mistake. I don't know what I was thinking. You're not going to get that from a narcissist. You are going to get a lot of manipulation, flipping things around on you, blaming you. So, my dear, run. Underneath, they suffer from a weak self-esteem and they are hypersensitive to criticism. I do like to use Gaston because he is the epic narcissist, right? And when in the movie version, when the father tells Gaston, Belle will never love you, what does he do? He smacks, Gaston smacks the father, and then he throws in a little antisocial behavior there by tying him to a tree and expecting him to die. There's less impairment in individual functioning and quality of life with this disorder. They're the ones that are going to be bachelors, constant bachelors, because they jump from one little butterfly to the other because they can get the girl. And a lot of times they're very good looking, they're charming, so they can get the person. But once you've been with them for a little bit, you realize, something's not right here. So then relationships end, and then they just keep going on and on and on. Parents may teach their kids that they have an unrealistic sense of talent, importance, and beauty. So for example, little Timmy brings a picture home, shows it to his parents, and his parents are like, that is the best stick figure ever. You are so talented. You are just better than everybody else. Now, I'm not saying that positive reinforcement is not something we should do. Yes, positive reinforcement, but to an extreme. And that gives them an inflated self-importance. So they come across as arrogant, an inflated view of their self, and they have an inflated view of their self-importance. Now, a little personal tidbit about me. The only place I really ever am is at school, work, or the gym. Where do you think narcissists thrive at? Where do you think they congregate? Of course, at the gym. Why? Because they can work on their muscles and they can take pictures of themselves. Oh, look at my muscles. I'm so strong. I am so beautiful. They're there like looking at themselves in the mirror like, yeah, right? So unfortunately, I have had my run-in with several narcissists. And yeah, not fun. But I'm getting better at recognizing them. With narcissistic personality disorder, they lack empathy for others, and this strains most relationships over time. They're very sensitive to rejection and criticism, yet they can be highly critical. So, for example, if someone tells a narcissist, "Oh, let's say you're in a relationship and you say, oh, you've gained a few pounds," he will say something like, "I've gained a few pounds. Look at your effing double chin," right? Highly critical. Everything is, they will immediately bounce back. They may exploit others. They feel intense shame deep down and have a fear of abandonment, but that would never come across. And perhaps because they have that fear of abandonment, they lash out and they act out in that manner. Their main pathological trait is antagonism with active hostility or opposition. They have grandiosity and attention-seeking behaviors. They tend to tolerate rejection poorly. Gaston would not take no for an answer from Belle, right? He had all the girls in the village, but he wanted Belle. Why? Because he needed her approval. That was the one girl. He wanted that trophy, right? If he could get Belle, that would inflate his own self-esteem. He wants what he can't have. And that's why they're so charming in the beginning, because it's almost a challenge for them. And they want to prove to themselves, like, I am good enough to be able to get this person. They thrive off of getting people to fall for them because that inflates their sense of, I am this amazing person. They may seek help for depression or for validation. So, for example, their relationship is falling apart. Their wife says, we really need to go to therapy because I don't think I can do this relationship anymore. He will go to therapy just so that he thinks the therapist is going to say, you know what? You're right. It's all her fault. I can't believe she's so demanding and she's so clingy. So that's what we mean when they say that they will seek help for validation. Guidelines for nursing care. So it's important to remain neutral. So as much as your skin will crawl when they're sitting there talking about how amazing they are, you have to remain neutral and recognize the source of narcissistic behavior is due to shame and fear of abandonment. You want to use therapeutic nurse-patient relationship to practice how to engage in meaningful conversation. Avoid engaging in power struggles or become defensive in response to the patient's disparaging remarks. So if he says something like, you're an idiot, how did you become a nurse? You can say things like, that's not appropriate, But again, you don't want to lash out and be like, how did I become a nurse? Well, you're dim-witted. I mean, I don't even know how you passed high school, right? That's not professional behavior. And you want to role model empathy. They are not likely to seek help for their own problems. They're more likely to be involved in couples or family therapy. And these family-oriented approaches, they're likely to deflect suggestion and will instead blame others. So once again, they're in there for therapy and they're like, let's say the therapist's name is Bob. Bob, how can she not expect me to cheat on her? I mean, look at her. She has let herself go. Look at all those gray hairs on her roots. I mean, come on. Cognitive behavioral therapy can help deconstruct faulty thinking. Group therapy may help in sharing with others and learning empathy. Lithium has been used in patients who demonstrate mood swings. So, for example, if they're very angry or if they're manic, then depressed. And antidepressants can be used if the person has symptoms of depression. So, again, a lot of the medications that treat these personality disorders, it's more treating the symptoms versus you can't really treat the personality disorder. With the personality disorder, they have to go to therapy. They have to be open to going to therapy, because if you force them, they're not going to be open to change. They have to think and recognize that they have a problem. With borderline personality disorder, they must have 4 or more of the following 7 traits, and at least one of those must be impulsivity, risk-taking, or hostility. So emotional lability, anxiousness, separation anxiety, depression, impulsive, risk-taking, hostility. With BPD, it's the most well-known and dramatic of the personality disorders, have severe impairments in functioning, instability and emotional control or regulation, impulsivity, unstable relationships. The hallmark of borderline personality disorder and what you're going to be tested on is self-injurious behavior. They are emotionally labile. One minute they're like, oh my God, girl, I love you. The next minute you're late for their PRNs and they're like, you are a piece of you can, and they're throwing a fit and they hate you. They respond emotionally to situations that are out of proportion to the circumstance. So you bring them a cup of water, you drop the cup of water, and they're like, I can't believe you haven't done that, blah, 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 right? They have a pathological fear of separation and intense sensitivity to perceived personal rejection. They're highly impulsive. For example, I had a client that when had diagnosed with BPD, the relationship had ended, and this person decided to jump off a building to kill herself. They act quickly in response to emotions without considering the consequences. I'm just going to go jump off this building, and I'm not thinking about how I'm going to hurt my family or how I'm going to hurt myself, that I may not die from this fall, that I may potentially severely cripple myself. Impulsivity results in damaged relationships and in suicide attempts. For example, they're in a relationship, their partner is sleeping, they send this person a text, and the person doesn't respond. Oh my gosh, why aren't you responding to me? Where are you? Why aren't you talking to me? Oh, they don't love me anymore. I can't believe, if you can't text me back, then I don't think this is going to work out, and blah, 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 right? Self-destructive behaviors are prominent. Ineffective and often harmful self-soothing habits. So, for example, cutting can be a self-soothing habit for them, or promiscuous sexual behavior and numbing with substances are common and may result in unintentional death. They're unable to cope with discomfort or with the pain, so they will do these harmful coping strategies, harmful self-soothing strategies. They may have chronic suicidal ideation. It's also characterized by feelings of antagonism. They may manifest as hostility, anger, and irritability in relationships. They may have physical violence towards partners. They may engage in property damage, and they may use splitting as their primary defense coping style. So, for example, they will idealize one parent and they will villainize the other parent. This parent was all good, this parent was all bad. Let's say, unfortunately, they experienced some type of abuse. The person that abused them will be all bad, and the mother will be all good. However, that's not necessarily the case, because the mother could have, perhaps the mother was aware of the abuse and never did anything, but with someone with BPD, they don't process that. They're like, no, my mother is all good, because they need somebody in their life that they can idealize. So even though the mother failed in the fact that she knew the abuse was going on and she didn't report or call the police on the father, the person with BPD will not recognize that. Splitting is the inability to view both positive and negative aspects of the other person. Someone is either a wonderful person or a horrible person. They're likely influenced by exposure to psychological, sexual, or physical trauma. They seek out treatment for depression, anxiety, suicidal, and self-harming behaviors, and other impulsive behaviors, including substance abuse. These individuals may attempt suicide many, many times. They're in the hospital system very frequently. They're Baker Acted here in Florida very frequently. Baker Act is that involuntary hold. So frequent hospitalizations, and fortunately, the personality disorder does seem to decrease with age. It's more dramatic early on, early in adulthood, in young adulthood, in the teenage years. This is the characteristic thinking. Normal thinking is across a spectrum, right? People aren't all good or all bad, but borderline thinking is it's all or nothing, it's good or bad. This person is either evil or good. They may have a feeling of emptiness. They engage in risky behavior such as reckless driving, unsafe sex, substance abuse, binge eating, gambling, or overspending. They have an intense feeling of abandonment that results in paranoia or feeling spaced out. Why hasn't he called me all day? What is he doing? Idealization of others and becoming close quickly. They can be angry, sarcastic, and bitter. I really like this quote. It says that people with BPD are like people with third-degree burns over 90% of their bodies. Lacking emotional skin, they feel agony at the slightest touch or movement. Assessment. You want to assess for self-mutilation and self-harm. Are they cutting in between their thighs where you can't see it? Are they cutting on their wrists and arms? You want to assess for suicidal behaviors, gestures, or threats. In a week, things will all be better now. One day they'll regret doing this to me, right? Those are all threats. Gestures may be giving possessions away. They may have extreme mood shifts that occur in a matter of hours or days. They have intense, unstable romantic relationships. Self-assessment. Be aware of one's own stress response to patient behaviors. Be patient with them, right? They are going to test you, and it can be challenging to take care of someone with BPD. So you have to be aware of your own stress response. Some NANDAs for BPD: risk for suicide, risk for self-directed violence, risk for other directed violence, social isolation, impaired social interaction, disturbed personal identity, ineffective coping. Signs and symptoms: impulsivity, bites, cuts, hitting, ingestion of harmful substances, inhalation of harmful substances, insertion of objects into body orifice, picking at wounds, self-inflicted burns, history of self-mutilation and suicide attempts, family history of self-destructive behavior, isolation, impulsivity, manipulation to obtain nurturing relationships. For example, saying something like, if you leave me, I'm going to kill myself. Planning and implementation. Be aware of manipulative behaviors. With BPD, in regards to their manipulation, sometimes it will be they manipulate you by threatening to harm themselves. Or they may flatter you, but again, don't fall for the flattery because tomorrow they may hate you. So manipulative behavior such as flattery, seductiveness, and instilling guilt. So for example, Susie Q is such a great nurse. She let me leave the unit yesterday and go down for a smoke, but you are a bad nurse. You don't care about me because you don't let me leave the unit. Implementation. You want to use straightforward communication. I understand that you want to leave the unit. However, it is against hospital policy that you leave the unit to go down for a smoke. When behavioral problems emerge, calmly review therapeutic goals. Remain neutral and address wounds in a matter-of-fact manner. So for example, let's say they hurt themselves. You're not going to scream and say, oh my God, I can't believe you cut yourself again. What are we going to do? Right? You just don't give them attention. Remember, they want that attention. So you address the problem, but you don't give them positive or negative attention. You remain neutral. Any attention, negative attention is still attention. So they cut themselves, you address the wound. You don't yell at them, you don't say anything, you just address the issue and keep it moving. You don't give them special attention for hurting themselves because that's what they're seeking. They're seeking that attention. The patient is instructed to write down the sequence of events leading up to the injury as well as the consequences before staff will discuss the event. Pharmacological interventions, again, SSRIs if they're depressed, anticonvulsants aka mood stabilizers if they have extreme mood swings. Naltrexone is an opioid receptor antagonist and that helps to reduce self-injurious behaviors, And second-generation antipsychotics may control anger and brief psychosis. In regards to teamwork and safety, you want to be consistent as a team, and you want to help ensure productive use of therapeutic time and structure for the patient. Advanced interventions, cognitive behavioral therapy can be very effective. Dialectal behavior therapy also. These are all different types of therapy that they can engage in. Pete Davidson is a comedian on SNL. He is very open about being diagnosed with borderline personality disorder. And he describes this. He says he's in dialectical behavior therapy. It's steps, it's thought processing. You have these thoughts, you have these feelings, you have these urges, you're going to freak out. Try waiting it out over 10 minutes. Try going for a walk to his fear of abandonment. When people say they're leaving and coming back, I get a really big fear that they're not coming back. And this is their struggle. They really feel that they're going to be abandoned, and it's a very real fear to them. Next is antisocial personality disorder. This is Ted Bundy. Recently, Netflix came out with a movie that Zac Efron played Ted Bundy. So people, the younger generation may not have heard of Ted Bundy, but now with this Netflix movie, now more people are going to know about Ted Bundy. With antisocial personality disorder, they have a total disregard for and violation of rights of others, usually at a young age. And they usually do start out with animal cruelty. That is a telltale sign. If one of your family members is, and I mean like cruelty that you wouldn't, for example, putting a bunny in a microwave and watching it burn or explode, or kicking cats, kicking dogs, torturing any kind of animal. And progressive, for example, maybe they start burning ants and then they progress to pulling the legs off a lizard. And if you see that they kind of have an enjoyment of it, get these people help, please, at a young age. They usually will have frequent run-ins with the law, so they may be in juvie. So this started around age 10. At age 15, they're in juvie. Consistent, they are deceitful, conning for profit or pleasure. So, for example, they call a little old lady and they're like, "Hi, my name is Jibola. I am from Nigeria and need your help with bank funds." And they steal everything from this little old lady and they don't care. They're like, "Well, she shouldn't have fell for it anyway." They have a reckless disregard for safety. "Stop driving, you are so high. Ha ha ha, vroom," right? Then, consistent irresponsibility. Your boss called, "When are you going to work?" Don't care, go away. Lack of remorse. "You gambled away my life savings. Well, life's unfair." Antisocial personality disorder. Once again, kind of what was said before. They're commonly referred to as sociopaths. Symptoms tend to peak during the late teenage years and into the mid-20s. They have antagonistic behaviors, such as being deceitful, manipulative for personal gain, or hostile if needs are blocked. For example, Gaston was kind of a mix of the narcissist and the antisocial, and when he couldn't get Belle, he became hostile, and he tied Belle's father to a tree. They engage in high risk-taking, disregard for responsibilities, and impulsivity, and cruelty to animals early on. They're concerned with gaining personal power or pleasure. In relationships, they focus on their own gratification to an extreme. They have little to no capacity for intimacy and will exploit others. They have a profound lack of empathy, also known as callousness. Callousness is a lack of concern about the feelings of others. So, for example, with this Ted Bundy movie, you noticed how, I forgot the girl's name, but his first person that fell in love with him, he was just doing a number on her. She was, she started out this happy person functioning in society. She started drinking, withdrawing, because he was just doing a number on her. The absence of remorse or guilt, except when facing punishment, and a disregard for meeting obligations, and they exhibit a shallow and superficial affect. And for example, he knew that, for example, he was in prison. He would still call her. He would, she was being put through all this turmoil, and it was only about him, and he didn't care about the pain that she was feeling, that she was being inflicted. And they may be experts at portraying themselves as concerned and caring if these attributes help them to manipulate and exploit others. Once again, they can be very charming. They may be willing to act witty and charming and may be good at flattery and manipulating emotions of others, but it's all an act, it's all pretend. For example, again, Ted Bundy would put a cast on his arm, or he would say, I have a flat tire. Very, hi, how are you? Oh, I have a flat tire. Can you come help me? Isolate them. Boom. Next thing you know, he's hitting them over the head and he got his next victim. They do not seek treatment unless court ordered to do so. Psychiatric admission may be for anxiety or depression. Entering treatment may be a way to avoid legal or financial circumstances. So, for example, let's say someone commits horrific crimes and the lawyer recommends to them, let's say that you were mentally unstable or this was momentary insanity. So they may do that as a way of getting out of it. Not that they have remorse or anything like that. It's just because they're seeking a way out. They may not give accurate responses. Now, fun fact, because they have no remorse, lie detector tests don't work on them because they have no physiological reaction to anything that they're being asked. They may have a rigid posture, hyperactivity, pacing, history of child abuse, history of violence, violates rights of others, anger, and aggression. So they may in turn have been abused themselves or physically, sexually, and then that created this shift in them, and they in turn will in the future. So once again, you want to do a self-assessment. These individuals have the capacity to be charming. You may want to defend the person. So this guy, I forgot the second woman that Ted Bundy got, that she would call the guy Bunny. But so she wanted to defend him, right? There's no way that this man did this. Or on the other hand, you may go to the other extreme. You may be disgusted. You may feel disdain or feel personally threatened, and you say, I can't care for this horrific individual. But you have to be able to separate your feelings from your professional role, and you have to provide care for them. Outcomes and planning. You want to maintain safety is the priority. That's the priority. They may have distrust, hostility, and inability to connect with others, and this will impair the usual process of developing a therapeutic relationship. You want to provide realistic choices for them, such as selection. You want to provide realistic choices, such as selection of a particular group activity. If they are involuntarily admitted, their loss of freedom might make them angry, manipulative, aggressive, and impulsive. Try to prevent or reduce manipulation by them. Set clear and realistic boundaries and consequences, and ensure that all staff follow limits. And keep yourself safe. If they're angry, keep yourself safe. Always, if you go in a room and you fear for your safety, take someone else with you. Don't go in by yourself. You want to follow a solid treatment plan. Emphasize realistic limits on specific behavior. Be consistent with responses. Make sure that there are consequences for actions. And simply listening can diffuse an emotionally charged situation. Cannot tell you how therapeutic listening can be to someone who's angry. That's all they need sometimes to vent. There are no FDA-approved medications for treating antisocial personality disorder. They may respond to lithium or valproic acid to help with aggression, depression, and impulsivity. SSRIs may help to decrease irritability and help with anxiety and depression. Benzodiazepines may help with anxiety, but should be used with caution because they are addicting. And normally, I am very against the use of benzodiazepines even being prescribed, especially for long-term use. If benzos are being used for, someone on a CWA protocol withdrawing from alcohol acutely, fine. But long-term use, not something we should be doing. There's other alternatives. This is a way of differentiating them on a spectrum. You have histrionic on this side, borderline. Here's impulsivity and instability. And it's a quick little summary of how this person is. So dramatic. The narcissist is grandiose. They lack empathy. Just a little easy way for you to remember each of the cluster B personality disorders. Thank you so much for watching. Make sure you hit the like and subscribe button.